All right. Hi, everyone, and welcome to this special episode of CCI Cast. My name is 𝖁𝖓𝖓𝖐, and I'm an interventional cardiologist based in Hamburg in Germany. I'm also a member of the CCI social media team. This July, CCI celebrates its 100th issue, and according to this special event, we selected the most cited, the most viewed, and the most important papers of the last 99 issues. Today, we will highlight the expert consensus statement on the use of FFR, IVOS, and OCT published 9 years before in 2013. So it is a great pleasure to welcome the first author of the publication, Dr. 𝖁𝖓𝖓𝖎, who is chief of the Division of Cardiology at Bayside Medical Center in Springfield, Massachusetts. He was the first author, and I'm very happy to have you on this special episode of CCI Cast to present what you found and commented on 9 years before. I'm looking forward to share the actual knowledge and outlooks with you on intravascular imaging and precision PCI. So, Dr. 𝖁𝖓𝖓𝖎, very welcome to you, and please share with us what are your insights, what happened 9 years before with your consensus paper.
Right. Thank you very much for having me. It's a pleasure to talk about this topic. You know, Eric, 9 years ago, we came together as a group, realizing coronary physiology and intravascular imaging was an important component of managing patients in the cardiac catheterization laboratory. And we believe by putting together a consensus document presenting the evidence in one paper would be helpful for the clinician to make decisions based on current model of care. And what we realized was coronary physiology and intravascular imaging are very complementary and can have great potential in assessing, treating, and hopefully helping decrease complications for patients.
Yeah, great. So a lot has changed when you published your consensus paper. It was 9 years before. A lot of studies came out, a lot of analysis of physiology, of course, of intravascular imaging, FFR, and OCT. What changed for you in your clinical practice, and what is the most important thing that changed?
So during that 9-year period, and we updated the consensus document due to this, you know, resting gradients, diastolic resting gradients, and whole cycle resting gradients came and shifted coronary physiology, actually made it easier to be used in the lab, understanding both its limitations and strengths. And then more and more data regarding intravascular imaging and OCT in patient management. And during this 9 years, not only are we talking about coronary physiology pre-procedure, we're starting to look at coronary physiology post, and simultaneously intravascular imaging has had more and more randomized studies coming out demonstrating the utility of intra-procedural management and long-term implications. So during that time, I have seen my usage of intravascular imaging and physiology increase, because based on the available data, it can be very useful when to intervene and when not to intervene on a patient.
Yeah. What changed in the last 9 years exactly? Is there anything in the consensus paper you would say that was not right, that was not completely right? We learned in the last 9 years more about it, which has to be renewed.
So you know, excellent question. I think what the consensus document stated at that time, during this time, we didn't have strong support for recommending imaging in all cases, but during that last 9 years, more data has come to support routine use of imaging in coronary cases. We didn't exactly get into this in the consensus document, but microvascular disease during the last 9 years has also become forefront in our knowledge base about coronary physiology evaluation. So I think what the consensus document did was lay the foundation, and what I'm happy to say that physicians out there did in partnership with industry then built the evidence to further propel why physiology and imaging is crucial in management of patients.
Yeah. And personally, what were your major breakthroughs in physiology and intravascular imaging since the consensus paper? Do you have any personal experience with it, or say this is a breakthrough in technology or in measurement?
So I think for me, the two breakthroughs that came, I began to use more intravascular imaging on a routine basis, and the reason I say routine basis is you have to understand the normal versus from the pathological. And by understanding that, sometimes you walk away saying this is best not to be treated. And then post-procedure physiology has also been helpful in understanding geographic myths or instant gradients. And right now, we don't have enough knowledge base to know if you intervene based on that, does that make a difference? But hopefully that sets the groundwork for the future to learn post-intervention physiology. How helpful would that be?
Yeah. So there we are at the point to take a look at outlooks or your outlooks on future technologies, and also on the acceptance of intravascular imaging and physiology. What do you think? What will be the future? What will be in the next nine years?
Well, you know, what I hope and what we don't still understand is this concept of vulnerable plaque. And I think an important assessment is, can we identify plaque through imaging that can help us assess who's at greater risk and who will benefit the most? Because right now, we look at it from a population base and take the population base data down to the general level. It would be fantastic if we can actually take what that person's information gives us from an imaging and physiology perspective, and we can apply their risk benefit to that individual rather than coding population based. So you said it best. You said precision imaging. This becomes personalized and precision management.
Yeah, definitely. I think that are brilliant words to finish what you have done and what we talked about. So thank you for the insights of the consensus statement. Thank you for the outlooks you gave to us, and thank you everyone for attending today. And keep an eye on the latest publications of CCI and follow us on Twitter, Facebook, and the YouTube channel. So bye-bye and take care.
Thank you very much. Best wishes.